Cool. Hello, everyone. Before I get started, I want to say two things. Firstly, big thank you to Felicity and the team for organising these. I've been coming to this conference for 3 or 4 years, and I learn so much every time, so thank you. The second is, I'd like to remind you all that Aline said you would remember every word that I say at the end of the day, so there will be a test. So I'm going to talk to you, I'm Jack, I work at Parexel. I'm going to talk to you about a bit of work we've been doing to build a global cost-effectiveness model template in R. Before I do that, here we go. I want to just, for those who don't know, briefly describe a sort of standard model flow in the pharmaceutical industry. So firstly, you would have a global team. They would build a global model. This model needs to incorporate all possible data sources, all the possible functionality that anyone might require. It may even need different model structures under it, so Markov model or partition survival model, for example. The global team may use it for some global strategy, perhaps some pricing. When it's all ready, they'll send it to their local country teams in all the different countries. They will adapt the model. They'll choose what settings they want. There may even be some particular settings they want to build into the model at that stage. They'll add in their own data. They'll use that for their own local strategies, their own pricing. They'll give that to a HTA agency who'll look at the model. Firstly, decide whether they can trust it for decision making. Maybe give it to an EAG who will say it's rubbish and tear it apart and build a new one using Warden or something. They'll then make a reimbursement decision based off that. This process looks linear here, but it may well be iterative. It may be that a new indication comes online and you start this process again. It may be that new data comes up and you re-update the model, all that kind of things. The reason I present this is just to describe, if we want R to be used widely for this process, there are hundreds of stakeholders all along this process in different countries with different technical abilities who all need to be able to trust the model does what it says, use and interpret the results of it. Actually, Howard, I think being able to export some model into Excel would be really helpful for this process. So that's the process. At Parexel, we are attempting to build a global proof of concept cost-effectiveness model that can really show to people why they should be using R and not Excel for this. And I think a big thing is, yes, we all know coding, the technical aspects of R is far superior to Excel, but there's also lots of benefits for those workflows for that process that are not yet demonstrated, I should say, but I'll try and prove them. Really, the overall aim is to support the uptake of R for HTA reimbursement decisions. And at the end of the day, for better decisions to be made, R is a tool that can facilitate better decisions, in my view, helping to get treatments to patients quicker, making sure they're the right treatments. Personally, I'd love to be the person who builds the first R model used in multiple HTA submissions. That's my sort of personal ambition. I won't dwell on this slide, and Rob presented a very similar one earlier. This is our sort of standard Excel model workflow. We would look to replace most of that with R. A key thing is we keep the data inputs in Excel. So as we've heard throughout the day, people are familiar with using Excel, especially in some countries who might not be familiar with R. Keeping that bit familiar really helps us to improve upon workflows rather than trying to say, you'll change everything, do something new. And another key thing, the report writing, R Markdown, and at Parexel, we've got our own internal Parexel GPT that we can use for report writing. I use it a lot. It saves me lots of time. Don't tell my bosses. So yeah, speaking of ChatGPT, I got very carried away with the image creator last night. This is a visual representation of my model. I thought it looked a lot like a stag, so I've come up with an acronym for this model. The standardized template for creating and adapting global cost-effectiveness models. So this is the first launch of the new name. I will have a hex at some point. Really, this shout out to Rob and the team. This is an image created using the R-HTA package. It's a tool used for validation. I find it really useful for describing how the model works. And I will go through how it works now. In the body of the stag here, we've got the main sort of model, how the main model runs. At the moment, it's a survival model. So we've got the F survival co-Fs running the survival analysis. That feeds into the F patient trace and the F TTD, time to discontinuation trace. They feed into lots of costs and utility functions, which are all run through a run model function. This structure in itself has the potential to save a lot of time for workflows. So in theory, say you want, okay, we've got a partition survival model. What if it was a Markov model? In theory, you get rid of the survival functions, you replace them with a Markov transformation, you have a new model. In Excel, that is a large job. This model can incorporate up to 8 treatments. In Excel, you would have to be changing 8 patient traces in different sheets, changing the input structure, takes lots of time, prone to errors. In theory, this really speeds it up. Another thing which really helps me is for large survival models like this, you may have up to 20 different drugs in it. For different countries who will have different vial sizes, have different costs of the vial, different doses they required, you have to work out the optimal cost of each drug. This is a really painful task to do. In this model, and we'll be looking to expand upon this, there's a function that does that in the blink of an eye really quickly. So again, this is improving workflows. This is saving time throughout the whole process. That's the body of the stag. In the tail and the hind legs, we've got our PSA functions, very similar, simple sort of SEP, SEAC graphs. This also runs an FPNMA, so if you have multiple comparators in it that weren't included in your trial, you can incorporate that. In the antlers, we've got our run scenarios and our DSA functions. Again, standard sort of economic model outputs. This run multiple model function just allows you to run the model for multiple different comparators. That's the model. I was hoping, much like Nathan, this morning I was trying to create a graph showing you all the different PSA times. I didn't get to that in time. Roughly for about 1,000 iterations, it takes 5 minutes for one comparator. So it could be quicker, but that's still a lot quicker than some very large Excel models. The next steps for the tool. So we validated this model against internal Excel models, so we know it does exactly what it says. That's not much good if we send it to someone else to say, don't worry, we've got this other model in file and it works against there. I really like to build upon the use of R-HTA here. For those who don't know, it's a package created by Rob and the team that you can use to validate models. I think this is really powerful because they're, again, I really like open source programming and functions, but there will never be one open source model that fits all needs. So having an open source validation tool means that people can be confident over whatever tool you do create. So that would be one of the next steps. Create a user interface in Shiny so that all those different stakeholders can interact with this tool. And a real key thing, and something that I'm really excited about, is the hosting situation. So I think that's sometimes a problem with Shiny apps, if you want to load sensitive information into it, how do you trust shiny.io that data is secure? So Parexel has a large clinical, in fact, it was a clinical research organization first. And that bit of the company has been using Palantir Foundry for lots of their work. For those who don't know, that's it's hard to describe. It's like a secure data integration platform where you can do everything in one place, all of your data flows really quickly, really securely. In our Access team, we're starting to use this tool. So I've used it when I worked at NHS England on the COVID-19 vaccination program. In that program, we went from having no COVID-19 vaccination data infrastructure to being able to say this many people in West Belfast over the age of 70 haven't been vaccinated yet. So this is a really powerful tool and one that I'm keen to look at as a hosting solution for this model. That's most of my speech. Does anyone have any questions?
Feel free to answer questions on the. Howard? Yeah.
So thanks very much, really interesting work. So I have 3 questions essentially. So the first one is motivated by, it says at the bottom here, this is confidential. So will this work is open source? And in terms of models, is it Markov models? Is it any type of models? And I've forgotten my 3rd question.
Good question. The confidential on the slide.
Will it be turned into a package?
Will it be turned into a package? Good questions. The first is the confidential on the slide. This is a standard template, and I just forgot to remove the confidential bit. So the slides will be shared. It won't be turned into an external package. So as much as I'd love to do that internally, it can be, as a consultancy, it can be difficult. What was the 3rd question?
What type of models does it have?
Oh, so currently it is a partition survival model. In theory, as I say, you can replace some of the functions. I think my ideal ambition, if I had all of the time and money in the world, would be you say, you have a drop down, you say what kind of model it is, you say how many states, it loads it all up. Currently, yeah, it's a partition survival model.
Brilliant. Are there any other questions? Javier?
What do you think were the hardest parts to implement in terms of challenging, and what do you think are the future steps that you would take?
Yeah, so in terms of the coding, I think some of the hardest bits, if I go back to my big graph, is whilst this way of building models is great for being able to pull out your functions, QCing, etc., you do have a lot of functions. So keeping a track of what functions are correct, etc., is difficult. And we've had multiple different people working on this. So that needs sort of careful management too. I think actually one thing that I found really difficult was when validating it against the Excel model had some errors in it. So did the R model, but trying to find those errors in that Excel model was really hard.
Brilliant. We've got time for one last question, so we'll go to Edna.
Hi, I'm just wondering, have you tested this out on many country level adaptations yet, and what have they found to be the biggest challenges?
No, not yet. That is one of the next steps. I think before we get to that stage, I'm really keen that the model's fully validated and we have this shiny user interface up and running. Because I think the UK's and we've said, Netherlands, some other are particularly advanced, but there's lots of countries that if you send them an R file are going to laugh at you and send it back, say, give us an Excel model. In fact, this is something happens a lot. If I'm always worried about sharing R things that aren't really, really good. Because if you share something that's not good, someone will go, see, I knew it, it's rubbish, we should just use Excel, we know what we're doing. So yeah.